DMH NewsLink, your trusted source for the latest in healthcare news.
DMH NewsLink.
Hi everyone, I'm Michaela Hunt, your host for DMH NewsLink, and we're here with Dr. Nathan Pyle today to talk a little bit about colon cancer and screenings and some of the advancements we're seeing right now. So thank you for being with us, Dr. Pyle.
Thanks for having me. Appreciate it.
So who exactly should be screened for colon cancer?
Yeah, so generally, anybody starting at age 50 should be screened, with the exception of African Americans. We actually recommend them starting at age 45 because there is a little bit higher risk of colon cancer for them. Otherwise, though, we also recommend screening for people that have a family history of colon cancer. When their parents or siblings had colon cancer at age 60 or under, they start at age 40 or 10 years before their relative was diagnosed.
I saw something recently that if you used a rotary phone, that's a good way to know that you need to get a colon cancer screening.
That's a good little cheat sheet. Yeah, I like it. That's good.
So there's something else that I've heard lately, a lot on the radio actually, about mail-in kits that can do the screening for you. Are those effective? Do they work?
Yeah, so the one out right now is called Cologuard. It's an excellent test, very good. It's about 95% effective at finding colon cancers, but also colon polyps. And so that does help us really reach a greater population than people right now. Right now, we're only effectively screening about maybe 65% of the population. So there's a lot of room for improvement for us to really reach out to the community. And Cologuard's a good way to do that. It's something you can do in the comfort of your own home, so you don't have to go out, you don't have to worry about maybe the fear of doing a procedure, that some people do have. And so if you can get them to do something like Cologuard, then you're effectively reaching that person that wouldn't have been reached before.
How is genetics really affecting what you do on a daily basis, and how will it affect it in the future, do you think?
So genetics is something, obviously, that's a part of all of us. It's something that's been a lot of advancements over the past, couple decades, and we continue to have advancements. Right now, we do have a lot of known genetic things that put people in increased risk for colon cancer, but I think really the future is finding something where you or I can get screened and say, you have a higher risk of, potentially getting colon cancer, and because of that, maybe you should get screened earlier than what I should. And so I think as the future goes on, we need to find those little genetic components that will help us in the screening process so we can really prevent colon cancer. That's the goal. It's not finding it, it's preventing it.
And you're saying you're seeing some younger patients right now, so I take it genetics probably plays a role in that.
It probably does, and that's what we'll wait and see kind of what the research continues to show. But younger people are definitely, we're starting to see a higher trend and higher numbers of younger people under the age of 50 getting colon cancer.
So screening is really important, especially if you have that family history too. Well, Dr. Pyle, thank you so much. And for more information, go to dmhcares.com/news.